Forever Fabulous. Welcome. I'm your host, Hanya. We talk about aging boldly on the show. Today's segment is going to be talking about does she or doesn't she? Plastic surgery. If I tell you how many women write to me and ask me about plastic surgery, cosmetic surgery, does it hurt? How much does it cost? They want to know the information. So today's show, we are going to be talking about really a few things, but we are really going to be specifying on facelifts because that's what I really get asked a lot of questions about. What's interesting to me is that 20 years ago, plastic surgery or facelifts were really for the wealthier woman. Today, and of course, the older woman. But today's clientele is much younger. And the fact is that wealth doesn't really play into it because there are all kinds of companies out there that make financing available for your plastic surgery needs. I find that to be a really wonderful benefit if that's something that you're interested in. So I'm not here to suggest one way or another if this is an option for you. This is a very personal decision, whether or not you really want to have cosmetic surgery. I'm here to say to you that cosmetic surgery is serious. And it's fascinating to me that the terms that are used for cosmetic surgery are things such as how cute, the tummy tuck, or the boob job, or mommy makeover. Doesn't that sound like you can just go down the street and have that done? The reality is that that is done specifically to ease perhaps the concerns that we should have. The other thing that I really want to touch on today is that there is this huge discussion amongst women about going overseas, getting on a plane and booking these so-called plastic surgery holidays. And quite popular would be going to Turkey. Here's my thought, my personal thought about this. And once again, you do your own research. I can speak from the experience of one of my dear girlfriends who went to have a tummy tuck in Turkey. Now, the reality is this. Tummy tucks are very invasive procedures, probably one of the most, and also one of the most painful, and also take the longest amount of time to actually heal. So if you really think that you're going for 2 weeks to Turkey to go for a holiday and have a tummy tuck, I can guarantee you that you're going to be laying in some room for the full 2 weeks, unable to move. That's how serious that procedure is. And then having to get on a plane to return back to the US or Canada or where you're coming from and spend that time in an airplane in the altitude when you're still healing. So this is something that I would caution you to really think about it. And I understand that, of course, cost is the driving force behind all of that. I would simply say to you this. If you're thinking about plastic surgery, make sure that, first of all, you truly investigate in your town, in your city, in your country, who is doing what. Plastic surgeons all have their own area of specialty. There is the guy who is the boob job guy. There is the guy who is the facelift guy. There are some doctors who specialize in a few things. But it's really up to you to investigate that and then make the appointment and go and see them. A doctor should be able to show you at least 50 photographs of before and afters of the procedure that you're asking about. He has to have that kind of bulk of experience in order for you to actually feel comfortable in his technical abilities. That is a must. We talk about prices. That is all over the board when it comes to towns and cities. For example, New York facelift is anywhere from $30,000 to $80,000. In Toronto, it can range up to $50,000 for a facelift, upper and lower facelift. So you need to be able to gauge your budget, and more importantly, I would say to you, why are you doing this? Ask yourself that question. If you're doing this just for you, I think that's fabulous. Make sure you understand for whom you're going under that knife. It should be for you, and you need to think about why that is so important to you. Make that determination. Plastic surgery is surgery. When we talk about facelifts, I always say, did she or didn't she? If you look to Hollywood, if an actress who is very visible to us, and that's why I'm talking about them, if an actress is in her 60s, for example, Demi Moore, and looks like she's 30, you have to understand that a great deal of money has been spent to look that way. And you have to understand that she's been under the knife more than once for a multitude of surgeries in order to look the way she does. And in fact, she does look fabulous, and that is her decision if that's what she wants out of her life. I understand that there's this whole pushback, and there is this whole thing with being as natural as possible. And we have these beautiful women who want to age without any kind of surgery. And I say, if that's what you want to do, that's fantastic. But this is about helping you make decisions and educating you if surgery is what you actually want to be attempting. A facelift, when we talk about upper and lower facelift, because we are talking about lifting here and we're talking about lifting here. So it's upper and lower. Most doctors will suggest that you have an upper and lower at the same time. The reason being is that you're being put under. The anesthesia is actually an important and very expensive part of this process. The anesthesia involved in the surgery is a very expensive part of the final costs. So the surgery, can it be done locally or are you going under? So in the fact of an upper and lower facelift, you're going under. And that can cause a great deal of stress to your body. That is why a doctor will insist on doing a full run-up on your health. You need to be healthy in order to have any of these surgeries, so that you understand. A facelift isn't just some 2-hour procedure. An upper and lower facelift can take anywhere from 5 to 9 hours, where you are laying on the table, you're out, and the doctor is working on you. So in order for that to be facilitated in a safe manner, you need to start this procedure in as healthy as possible way. And that's why doctors will do all kinds of run-ups on you before the surgery even begins. Together with the upper and the lower lift, what's popular today is, of course, the lip lift, where they actually cut in around the nose and they lift this upper lift enough to produce more of a fullness to your upper lift. As we age, that starts to drop and we get that look of aging because the mouth, the upper lift, loses its fullness. So popular today is that lift procedure. Usually when you're doing the upper and lower facelift, a doctor will suggest that you do that as well. On top of which there might be a brow lift and also lifting of the eyes a slight bit to the sides to give you a bit of that cat look. What is really wonderful today is how we are using fat grafting. So we are utilizing our own fat, and the doctors are then injecting that fat into our face and using it as a natural filler. As a matter of fact, 2025, most popular trend will be to use your own fat, whether it be to inject into your face instead of a filler, or perhaps if you want to augment your breasts. People are now going to be moving towards using their own natural fat. It is sort of the more healthier aspect of where we're moving in the future for plastic surgery procedures. When we talk about the facelift, let's talk about the downtime, what you can expect, the healing time. Plastic surgery, if you have a really great plastic surgeon, I call them cutters and sewers. It's just how I term these doctors. Can they cut and sew? And when I say that, when I go to look at their book of all the work that they have done, I want to see how well they have sewn, what are the sutures like around the ears, because those are the telltale signs where they tuck in through the ears and behind the ears. So you want to be able to look at close-ups of how that doctor has sewn. What kind of technique has he actually used? How good of a sewer is he? Because those are your telltale signs. For me, I think it's important to find a doctor that is on the conservative side of things in terms of his achievement in what he's trying to achieve with you. Please understand that this is surgery. Once you lay down on that table and the doctor starts to perform, he has to be faced with how your face and how things are responding then and there. So you may have come in with a list of 1 to 10 of what you would like to see done, but it might not be possible when he's actually opening you up and working on you. So having a positive and proper mindset about what your expectations are for the result is extremely important. Understand that you are a human being and not some photograph, and that to expect perfection is probably not 100% the way that it's going to follow through for you or anyone, to be honest. So in terms of you've had your surgery, now you're waking up the next morning, perhaps you're at home, or perhaps you've stayed over in a facility, which is something that I would suggest so that the nurses can care for you through the night. You wake up in the morning, what do you expect to see? If the doctor is a really qualified, experienced doctor at facelifts, there should be minimal bruising. When I see on the internet these girls where their faces are black and blue and they're swollen, I understand that they have not been worked on by really experienced doctors, because really an experienced doctor, in the next morning, of course you should be swollen. There should be some swelling. I'm not saying that there isn't swelling, but it's not something where your face blows up to be a size of a balloon and that you're black and blue. That's not a really qualified, excellent surgeon. That's my experience. The people that I have seen and talked to, when you look at their befores and afters, a good doctor will show you the morning of. He will show you 5 days out. He will show you 2 months out after surgery. Look at those photographs. You want to be able to go out of your house within 1 week, and with the exception of perhaps a little touch-up makeup to the sides, you should be looking like yourself. Here's a really important point that I want to share. Doctors who are conservative with what their approach is are looking to keep you looking like you, but turning back the clock. You should look like you have had a great holiday, like you have had a great year of sleeping. You should still look like you. That is really an optimal result. How long is that going to last you? The question that I get asked all the time. The younger you start with a facelift, the longer that result is going to last you. Therefore, you have a lot of young girls in their 30s who are starting with their first facelift. Now, I think that's extremely young, but that seems to be our trend. That 35-year-old can truly expect for that facelift to last her 10 to 15 years. If you're older, you have to understand as we age, we are aging faster. So if your first facelift is at 55 years of age, know that every year that goes by, we are aging quicker. So that facelift is not going to last you as long in terms of years as the person who started in her 30s or maybe early 40s. That's the nature of aging. So you should be aware of that. Women today are having 2 and 3 facelifts. That is what is happening. The affordability, as I have mentioned before, it is really anywhere between $20,000 to $50,000, and in New York can go as high as $80,000. Those are the costs. So those are my thoughts about facelifts and what you can expect in terms of result, how long that's going to last you, and hopefully I've answered enough questions for you to make some decisions that are going to help you whether or not you want to go down that road. I think it's important that if you need financing, look up what's happening in your state or your province, who can offer that to you, and always stay safe, take your time, make the selection, don't be hurried, and good luck. One of the most important things that you have to know about me and why I am producing this channel is that everything that I want to say to you is truthful and honest. I'm going to give you my real opinions. There's not going to be some kind of convoluted ideas here. I come to you with authenticity and with honesty, and that's what this is all going to be about. My hope is that you're enjoying what I'm bringing forward to you, the information. Please invite your friends, subscribe to my channel. I hope to grow my audience. I hope to grow the sisterhood, and I hope to see you all next time. Thank you.